Did you know that Black Americans are almost twice as likely to die from preventable diseases compared to white Americans? These aren't just numbers, they represent families torn apart and lives lost unnecessarily. This disparity doesn't exist because Black communities are weaker. It exists because systemic racism in healthcare denies them the same opportunities, care, and resources. But what happens when someone refuses to accept this injustice? What happens when one man decides to fight back, not with anger, but with action? Today, I'm sharing the story of Dave Johnson, a man who faced unimaginable challenges to become a doctor and transformed his community by refusing to let racist policies win. Stick with me, because this story isn't just about Dave. It's about what happens when resilience, love, and determination collide to create real change. Dave Johnson wasn't supposed to make it, not according to society's rules. Born in one of the most neglected neighborhoods in the city, surrounded by poverty, violence, and a healthcare system that seemed designed to fail people like him, Dave had every reason to give up before he even began. But instead, he did something extraordinary. He fought. Not just to survive but to thrive, and to bring his success back to the very community that raised him. This isn't just a story about one man. It's a story about the power of hope, the strength of community, and the determination to change a broken system from the inside out. Let's take a moment to talk about the reality of systemic racism in healthcare. Did you know that only 5% of doctors in the United States are Black? That means millions of patients, especially in Black and underserved communities, never see a doctor who understands their unique struggles or takes the time to truly listen. Black patients are often dismissed when they report pain, leading to late diagnosis or no diagnosis at all. Pregnant Black women are 3 to 4 times more likely to die from childbirth complications than white women, even when socioeconomic factors are accounted for. Dave saw this disparity firsthand, and it became his mission to change it. But it wasn't just about the patients. The road to becoming a Black doctor is full of obstacles, too. Dave faced it all: professors who doubted him, classmates who dismissed him, and policies that seemed designed to keep him out. One day during his first year of medical school, Dave raised his hand to answer a question about heart disease. He gave the correct answer, but the professor smirked and said, "Well, you must have memorized that. Let's see if you can keep up when things get harder." The comment wasn't about his intelligence, it was about his skin color. Moments like this weren't rare. Scholarships he qualified for mysteriously disappeared, internships he deserved went to less qualified peers, and the system constantly tried to remind him he didn't belong. But Dave never backed down. He later said, "Every insult, every obstacle, I didn't take it personally. I took it as proof that I had to keep going, not just for me but for everyone coming after me." Dave's story begins in a tiny apartment in the heart of the city, where he lived with his mother, Maria. She worked 2 jobs, cleaning houses during the day and waiting tables at night. She didn't have much, but she gave Dave something far more valuable: belief. "Baby," she used to say, "don't let this world make you feel small. You're not just a Black boy from the block. You're a king. And kings don't quit." Dave took those words to heart. While other kids played outside, he was at the library. He devoured books on science, math, and even medicine, dreaming of a day when he could wear a white coat and save lives. But the road wasn't easy. When Dave got into prestigious medical school, he thought the hardest part was behind him. He was wrong. The racism he faced wasn't always loud, but it was constant. Professors doubted his abilities. Classmates avoided him. And every step of the way, he had to prove he belonged. One summer, while his peers traveled or relaxed, Dave worked 3 jobs to pay for textbooks and living expenses. He barely slept, but he never complained. "I didn't have the luxury of giving up," he later said. "Too many people were counting on me, even if they didn't know it yet." After graduating, Dave had countless offers to work at high-paying hospitals. But he turned them all down. Instead, he returned to his community, the same one that many told him to leave behind. Using every dollar he had, along with loans and donations, Dave opened a free clinic. Yes, free. He didn't just want to treat people, he wanted to create a space where everyone, regardless of their income or insurance status, could feel seen, heard, and cared for. The clinic became more than just a medical center, it became a symbol of hope. Dave didn't just treat patients, he educated them. He set up workshops on diabetes prevention, nutrition, and mental health. He organized free physicals for kids, ensuring they were healthy and ready for school. And he started a mentorship program to inspire the next generation of doctors, engineers, and leaders. One of his mentees, Jamal, was on the verge of dropping out of high school when he met Dave. Jamal had been in and out of trouble, and most people had written him off. But Dave saw potential. He sat Jamal down and asked, "What's holding you back?" That conversation sparked something in Jamal. Today, he's studying pre-med, inspired by the man who never gave up on him. But the most heart-wrenching moment came during the pandemic. When COVID-19 hit, Dave's clinic became a lifeline for the community. Hospitals were overwhelmed, and many refused to treat patients without insurance. Dave and his small team worked around the clock, often pulling 20-hour shifts. One night, a desperate mother rushed into the clinic with her 6-year-old son, Jamari. He was struggling to breathe. She had been turned away from 2 hospitals because she didn't have insurance. Dave didn't hesitate. He treated Jamari on the spot, staying by his side until he was stable. When the boy finally smiled, his mother hugged Dave, tears streaming down her face. "You saved my baby," she whispered. Stories like this happen every day at Dave's clinic. And through it all, he never asked for recognition. "I'm not a hero," he often said. "I'm just doing what's right." If you've made it this far, let's take a moment to connect. Tell us in the comments where you're watching from. Are you from a small town, a big city, or maybe even another country? It's amazing to see how stories like Dave's can reach people all over the world. And while you're here, let me ask you, what part of Dave's journey inspired you the most? Was it his determination, his love for his community, or his refusal to back down in the face of adversity? Share your thoughts below, we'd love to hear from you. Dave Johnson didn't just become a doctor. He became a healer, a mentor, and a force of change. He fought against a system that wasn't built for him and proved that one person's determination can transform an entire community. Because of Dave, thousands of lives have been saved. Thousands of kids now dream of futures they once thought were impossible. And a community that was once overlooked now knows its worth. Dave's story isn't just about him, it's about all of us. It's about the power of resilience, the importance of representation, and the belief that we can change the world if we refuse to give up. Let's keep the conversation going. Tell us in the comments, what inspires you to keep pushing forward, even when the odds are stacked against you? Let's celebrate stories of resilience, hope, and the power to create change. Thank you for watching, and remember, the world needs people like you to believe in what's possible. See you in the next video.